Patients in England who were given contaminated blood are receiving 4 times as much in support payments than similar patients here. The average payment in Northern Ireland is around £4,000. The figure in England is around £18,000. The public inquiry into the scandal has heard how 5,000 people were infected, including 100 men and women here. Our health correspondent Mary-Louise Connolly reports.
They may appear like they haven't a care in the world, but these two are affected by what's been called the biggest treatment disaster in NHS history. They're among the 5,000 people across the UK who received contaminated blood in the 80s, a huge scandal which is now the subject of a UK-wide public inquiry. But ever since April, when the former Prime Minister Theresa May decided to increase financial support for people affected in England, people like Conan and Paul have been fighting the authorities here for the same treatment.
So this letter indicates that they're working in the background and have been doing so for a year, whilst England have worked and actioned within 6 months.
As a result of the infected blood they were given as children to treat their haemophilia, they have both hepatitis C stage 1. They receive an annual payment of just over £4,000. But if they lived in England, they would receive £18,458. That's a disparity of more than £14,000 annually.
That's almost a life-changing amount of money to normal people. The security is not there for our family, for our loved ones, because there's no bereavement payment if something happens to us. We can't get life insurance, so where is there security going forward? And it's down to geographical location, because we were all treated with the same blood from the same pot.
And in Scotland and Wales, patients like Conan and Paul can receive additional support if they meet certain criteria. In a statement, the Department of Health said payments here had been similar to England until the new uplift. It said there were no extra resources made available to Northern Ireland as a result of the English announcement. It added that it's working with colleagues in the Departments of Health in England, Scotland and Wales to explore what can be done to take forward the principle of parity of support. But according to this group and those they represent, they're not confident there will be any movement anytime soon.
In England, they intervened in April, and as we stand today, there's no movement within Northern Ireland. We're getting a lot of sympathetic letters from both the government and the politicians, but as it stands today, both the Department of Health, led by Richard Pengelly, and the Department of Finance, led by Sue Gray, haven't acted.
Meanwhile, the Department of Finance has told the BBC that the issue will be part of their discussions when planning next year's budget. Mary-Louise Connolly, BBC Newsline.